This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo. Benton, Franklin, and Yakima counties, all in eastern Washington, are moving into a modified Phase 1, but it's not because they're improving. State Health Secretary John Weisman says this decision is based on the fact that people out there are leaving the area and are visiting open businesses in other counties, thus risking the spread of infection.
So this is a containment strategy to help prevent the virus from spreading into other counties. That's the reason these counties have been moved to a modified Phase 1.
So essentially he's saying he hopes that, opening up more businesses where they live will keep people closer to home. And in this 1.5 phase, construction and manufacturing can resume. Outdoor dining and retail is also allowed with limited capacity. Do we like this technique, Dave? What do you think?
Talk about a complete change in direction. That's got to confuse people. So now the way to stop the spread is to reopen, even if you don't think it's safe. I hope it works. I mean, the problem there has been the reluctance to wear masks, and they've been struggling to figure out some way to make it more palatable for people. I would say, Aaron, at this point, looking at the way this is spreading around the rest of the country, you have to try a lot of stuff and see what works. I guess if this doesn't work, they'll have to try something else.
Yeah, the governor had this saying for the whole mask policy, right? Mask up to open up. Mm-hmm. I wonder if there's a new saying we can do for this sort of idea where you have to, stay close to open up. Or that's not very catchy. I don't know. I can't think of something.
Mask up, or we're going to build a wall to keep you where you are.
That's got a nice ring to it right there.
Yeah. Makes for a very long bumper sticker, though.
Indeed. Quick update now on the coronavirus outbreak at the University of Washington. Over 100 students on Greek Row have now been infected. Students are isolating in their rooms while they recover. UW-Medicine has a pop-up test site near Greek Row, and they've processed nearly 1,300 tests in the past week. President Trump is facing backlash after falsely claiming most COVID-19 cases are just no big deal.
We have tested almost 40 million people. By so doing, we show cases, 99% of which are totally harmless.
FDA Commissioner Stephen Hahn struggled to defend that claim when he was asked by CBS News if the president was wrong.
So I'm not going to get into who's right and who's wrong. What I'm going to say, Dana, is what I've said before, which is that it's a serious problem that we have.
Here's what the mayor of Austin, Texas had to say. Steve Adler told CNN the president's claim doesn't seem to reflect what's been happening where he is.
We have the July 4th weekend, and we need everybody wearing masks. And when they start hearing that kind of ambiguous message coming out of Washington, there are more and more people that won't wear masks, that won't social distance, that won't do what it takes to keep a community safe. And that's wrong, and it's dangerous.
And the president's former Homeland Security advisor, Thomas Bossert, issued this warning.
We have to start at the basics and level with people. Suggesting that it's not dangerous is in itself a dangerous message.
Here's what we know are the facts about just how dangerous the virus is. The World Health Organization says about 20% of those diagnosed with COVID-19 progress to severe disease, things like pneumonia and respiratory failure. President, of course, we heard he also claim that increased testing is the only reason cases are rising. Well, that's not true either for a few reasons. In certain areas across the country, we're seeing the demand for ventilators rise. That's approaching the highs we saw back in April. And also hospitalizations are rising. Certain parts of Texas and Arizona, they are seeing their hospitalization rates hit crisis capacity. Dave, is there any other reason the president is saying these things other than the fact that it's an election year and he just wants the economy to go booming?
That's probably
again?
Part of it. I was trying to figure out what this was. He was saying of 40 million people tested, let's see, only 1%. Well, the way he put it was 99% totally unharmed.
Right.
So that would apply if we're defining harmed as dead, because it's true. Mm-hmm. The death rate compared to testing is under 1%. If it were, let's say, at 1%, that would be 400,000 dead people. So that's a significant number of dead people, even though it's only, quote, 1%, because you're talking about so many tests. So maybe that's what he meant. I think it's pretty clear that he doesn't want people to be so frightened that they they don't go out and shop. The ironic thing is, if he came out, I think, with the very strong "Let's Mask Up" campaign, people probably could go out more without worrying about the consequences of being indoors for at least a limited period of time, the time it takes to have a restaurant meal or to shop. But except for that one comment last week, he has been very reluctant to put on a full court press on the mask campaign.
He has not been so reluctant to hold mass gatherings, though, even though his own task force recommends against it. We saw the big gathering for the 4th of July. He's also, I think, planning another one. I don't know if it's this week or next week, but another big outdoor rally where masks will be provided, but they are only encouraged, not mandatory.
And so far, from what I've heard, the outdoor stuff has not been a huge problem. I think the outdoor stuff that has been a problem is when people gather on the beach and they get really close to each other and are breathing in each other's faces or whatever you do on the beach these days. But the mass gathering thing so far hasn't, at least I haven't heard the experts say that the mass gatherings, the rallies, and even the demonstrations have been a huge source of contagion.
More than 200 scientists from around the world are challenging the official view of how the coronavirus spreads. For now, the World Health Organization and the CDC say we only need to worry really about 2 ways the virus can transmit: through touching a contaminated surface and then rubbing your eyes, your nose, your mouth, or by inhaling droplets from maybe coughs and sneezes from an infected person.
But some experts are now saying the virus can linger in the air longer, in particles, really tiny particles, known as aerosols. The concern, they say, is the particles can hang around for long periods and float dozens of feet. That would make certain indoor spaces with poor ventilation even more dangerous, even when people are 6 feet apart.
So now nearly 240 scientists and researchers from around the globe, they are calling on the WHO to revise its recommendations. So far, the health organization says evidence of the virus spreading by air is unconvincing. It has acknowledged, however, that the virus can be spread through these aerosols during certain medical procedures, like an intubation. That's because those machines can spew large quantities of the microscopic particles known as those aerosols. So what does this mean for schools, businesses, nursing homes that want to reopen? I guess better ventilation systems might be needed. What other changes?
Well, I mean, for example, in an airplane, there's a ventilation system right above you. So presumably anything you breathe out is sucked into that vent right above your seat and doesn't spread around the plane. They have these super duper air filters in the airplanes now. They can actually get these tiny viral nanometer particles out of the air. So they seem to have solved that for airplanes. To retrofit every indoor ventilation system in the country with that would probably be a problem. The solution would be if everyone had access not just to these cloth masks, but those N95 masks, which are designed to stop incoming particles, as opposed to the masks that we have now, which are designed to stop outgoing particles. But for some reason, we still can't ramp up production of those masks such that people besides those in the medical industry can have them.
And masks are relatively cheap compared to retrofitting buses with the new ventilation system, for instance. So.
Much cheaper. A little more inconvenient, but that's what their job is. That's what they're designed to do. So why not make sure everybody has one? We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.